All right, we're going to pump this blood pressure cuff up a little bit. This is going to act as a better tourniquet for your arm so we can see these veins a little bit better. So we pumped up to the systolic and right down to the diastolic. Go ahead and pump your fist a few times. 10 or 15 times would be great. Use some alcohol pads here. And we're going to try to push some of this blood down your arm to get these veins to fill up so that we can see what kind of veins you have for us here. Notice how these veins are starting to plump up very nice. Some of the best veins to use are in the forearm because those tend to last longer because they're not in the bend of your arm, they're not in the bend of your hand or down here in the wrist. So if you can find something that's, you know, from the wrist up to the AC here, those are the best areas. So that's where it's nice to find those veins if you can find them here. So you're seeing a few pop up here on the forearm. We're seeing one here that's past the wrist. This one here is kind of crooked, so I would stay away from that because you come in here, your needle's going to have to do that. So right here, we're kind of out of the hand, which is still, you can now allow wrist movement here. So that's a nice vein to go with here. So I'm going to flip that vein a few times, help it to fill up. I'm going to clean the area. And this is an example in the wrist, so we want to make sure that skin and vein doesn't move away from us. So we're going to bend that wrist down just a tad here while pulling traction here with the thumb. You don't want to pull too hard or bend too much so that vein collapses and you cannot see it. Just enough to pull that tight here. And you want to make sure your thumb is down and the angle of the wrist is down enough so that it's not in the way of your needle. If your angle is too steep, you're going to go through the bottom of that vein. So you want a nice shallow angle there. Let me show you here. Okay, you're going to feel a poke. 1, 2, 3, poke. There's your flash. Advance 2 to 3 millimeters. Lower your angle and thread that catheter off. Notice how you have the sides held here and you're using your index finger to thread that needle off. It's very important to release your pressure before pulling the needle out of the hub here. It's also a good idea to, once your IV catheter is threaded, to keep a hold of your IV at all times in case your patient would pull their arm. That way, if you have a hold of the wrist, your hand goes with it. And now you can fill your blood tubes and then flush it with saline and dress that vein with a appropriate dressing. When dressing your IV, you want your notch to be at the top so that it grabs to your dressing. If the notch is at the bottom, that's going to cause irritation to the skin. So always make sure that's at top. splice this and get a little tourniquet here to get the blood to fill. Sometimes you can see the blood's not coming. Sometimes there are valves or the catheter is positioned on the vein. So you just give a little pull back. Just see how that blood comes. If I pull the skin back a little bit and release, that just means there's a valve there that the catheter's against. There's nothing wrong with that. We don't know where valves are in the veins. But this is a good example of how that blood will fill, even though we're not initially seeing that. Again, I'll show you again. There's not blood coming, but just pull back just a little bit. Pull that catheter away from the valve, and that blood tube will fill up. After you filled your blood tubes up, remove your vacutainer, and we'll flush this IV. Make sure you release your pressure before flushing the IV so you're not pushing against the pressure. And there's your IV.